not to belabor the point, Gene did a great job introducing me, but the group of 16 surgeons in the Mission Hospital system that do joint replacement, the administration looked at all surgeons and every one of our joint replacement surgeries, and there's a sophisticated system that Stryker Analytics has to look at how we're doing. And I was pleasantly surprised that I scored well. And just the highlight is, I think, since 2011, I've been really advocating for getting out of the hospital because you're more comfortable out of the hospital than you are there, and probably safer away from the infections. Even at a low hospital infection rate, I think people do better at home. So part of the reason that I've been able to score, better than my peers, in large part, is because I've been using this technology. I had good training, but in 2012 I started using this patient-specific technique, and since 2011 I've been performing these in outpatient surgery centers, or if you're in the hospital, encouraging people 25 hours later to go home. So why should we think about doing this? As a patient, this is the primary concern. We want our patients to do well. And even the best surgeons who do surgeries in surgery centers and hospitals will tell you that our infection rates are lower for just about any surgical procedure generally in a surgery center than a hospital. The other thing, that if you've been a patient in a hospital, regardless of what you're there for, there are all kinds of checks of your vital signs and bells and alarms and whistles, and you're just more comfortable as a patient being at home. In terms of why we should think about doing it if you're not the patient, is the government now is giving us a lump sum to do these procedures, and it's important for all of us to be conserving dollars as medicine gets more and more expensive. What's not well known is that over a 20-year period, and it's not just the baby boomer effect, there are more and more people that are getting arthritic and needing to have joint replacements. Knee replacement over 20 years ending in 2026, that number is 673% higher, which is just mind-boggling. And in hip replacements, it's only 172% higher 20 years over that lifespan.